Good afternoon, sir.
Good afternoon.
Yeah, can you please give a brief introduction of yourself?
Um, Professor Wasiu Lanre Adeyemo, the Chief Medical Director of Lagos University Teaching Hospital.
Okay,
You
thank
there
you.
about Lagos? Thank you.
Yeah, it's so good to have you here, sir.
Thank you
So,
very much.
being a health professional, from your wealth of experience, must have had different cases. So, can you please share one of the most difficult cases you've handled here as a health professional, and how did you handle it?
I have to talk in relation to being a manager and also a CMD. I also have we have a vision of actually bringing hospice and palliative care to Lagos University Teaching Hospital. And our story is in the last 2 or 3 years, there's no doubt about the fact that there's a need for us to have a dedicated specialist, doctors, nurses, anesthetists, physiotherapists, and so on and so forth, dedicated, pull out of the crowd and make sure that they are dedicated to care for hospice and palliative in terms of a care to patients. As a hospital, also, we have it as part of our strategic plan to have a building dedicated for that because we have seen the need. In the last 2 or 3 or 4 years, you've seen cases where patients, the end of life, what they need is end of life care, and many of them don't require admission in our regular ward. And some of them, they are physicians and surgeons. They, as far as they are concerned, they are done with them. What they need is for us to take care of their pain and also relieve them of a discomfort. And as a management, we've seen that need. So that's the reason why we have set up a committee for that, and we are training. That's why we are also supporting this kind of conference. We have dedicated a place in the hospital to build a 3 or 4 story building for that purpose, and it's also included in our budget. I've had instances where people call me that after patients have been discharged, maybe very old patients, 80, 90, or those who have terminal illnesses, that the surgeons or the physician, they have discharged them, but they don't want to go because probably don't have the facility to take care of them. So, and sometimes they will call me and say that, please, can you help us appeal to their doctor that they do not want them to come home? And I said, look, I'm just an administrator. I'm not the attending physician or attending surgeon. They need to go. Probably they need to go to any hospice and palliative care in the city. But the federal government has given us funding to make sure that that category of patients, we also take care of them. That is why, despite the fact that we have created a small place for them in the hospital, Lagos University Teaching Hospital. And also, they do run the hospital for those who need the care. But we realize the fact that there's a need for us to have a dedicated place, and that is what we have done. So, as a hospital, we are aware of the need, and we are doing everything possible to make sure that we provide that need to a lot of, Lagos, you have about 25 million or thereabout.
Yeah, sure.
And hospice and palliative care in Lagos, I'm not too sure whether you have many places, particularly in the public institutions. So that's what we are doing as a.
Okay, thank you, sir. Sam, how do you intend to combat the rising issue now? Because I know this issue demands an urgent attention. So how do you combat it, the issue of negligence among medical practitioners, especially nurses, and their lack of empathy, how they relate with patients when they come to the hospitals for treatment?
You're talking about supposed negligence or supposed lack of sympathy.
Yeah, lack of sympathy, and we've seen cases of that.
No. You have, I'm a doctor, I'm a surgeon, I'm also an administrator. The perspective that people read in the news is not entirely true. Let me give you an example. Somebody called me today and told me that there are a patient in LUTH that have not been seen in the last 48 hours. My response was that is not possible in LUTH, particularly in accident and emergency. You don't take what people say and think it is true, because those who are staying with them, they are not doctors, they are not nurses. They may not know them, but some of them, I agree that we may have some issue with in terms of communication. But negligence, you have council, Nigeria MDCN, Medical and Dental Council of Nigeria, for doctors, and also National Medical Council, as well as the management of each hospital. Negligence is unacceptable in our hospital. But don't forget that we are human beings. But not every case of negligence. Even if you talk about medical negligence, is in medical literature, meaning that it's not only here that it happens, but as a management, we have done a lot. We have committee that actually in charge of that to make sure that number one, in terms of professional competence, we make sure that it's only those who are competent that we employ. Also, in terms of training and retraining. And if you have any case of medical negligence, we set up a panel within the hospital setup. And sometimes, if I'm also aware of several cases where MDCN has come in, National American has also come in too. But to say that medical negligence, the way people say it happens, just like it happened in anywhere in the world. It happens in Nigeria. But we are doing a lot in our hospitals, despite all the challenges that we have. So for us as a hospital, is for us to make sure that we train our staff. The first thing is we employ those who are competent. Then we train them and make sure that the issue of medical negligence is reduced to the barest minimum. So that's the way I will. But it's not every time that somebody's. I'll give you an example.
Yeah, like what we do on Cordial TV now. This is.
Okay. I'll give you an example. Somebody called me today and said a particular patient has not been seen in 48 hours. My reply was that it's not possible in LUTH. And I took my staff and my other colleagues, the CMAC and everybody, we went there. When you are there was a doctor there. So the question is that, there are some things that I know that we may be lacking, essentially, the way we communicate with patient and patient relation. Yes. So it's not everything, anytime they say medical negligence, that they may not know, because if we don't communicate to them, but don't get me wrong, medical negligence is there. And it's not only peculiar to Valley, Nigeria. It's almost everywhere. But the responsibility of management is to make sure that you reduce this to the barest minimum. One, employ those who are competent. Number two, training and retraining. Number three, and say zero tolerance to medical negligence. Thank you very much.
Thank you very much.